bureaucracy. And you had said before you were elected leader that you were going to absolve the LHINS. Now, I haven't heard from you about it since you've been elected leader. And when I spoke to the Premier, he had mentioned that the LHINS are working closely with the community to try to sort through these problems. Is this a commitment that you're still willing to go ahead with?
Let me be clear. As Premier, I will close down the LHINS. I'll put every penny into local health care for families instead. We follow the local papers, and I know this is not simply a Niagara issue. The Niagara one is illustrative, though, of the problem. We have a hospital in Grimsby that has moved nowhere. It's had tremendous community support, great people that work there, but they're stuck in an old building that no longer serves the people who work there, more importantly, the patients. The project's gone nowhere. Down the road, probably 2 kilometers, is a brand new fancy office for the LHINS. It just drives people crazy, and rightly so. So a new office for bureaucrats, who may be wonderful people, but quite frankly, they don't spend a single minute with patients. They don't do any surgeries. They don't deliver any babies. But we put $250 million into these things across the province. I know this has popped up in issues in many of your communities as well. I just reject the LHIN approach. They're anonymous, they're unaccountable, they're unelected, they're making crucial healthcare decisions, allegedly, but have no direct accountability to people who pay the bills. I think they're a tremendous waste of money, and in reality, you know what they are? They're nothing more than an expensive shield that the government to hide behind when it wants to delay a project or close down an ER like happened in Fort Erie. Anyway, another thing to the question. If I haven't been clear, I will close the doors of the LHINS, put every penny in the frontline care instead.
And open up the emergency rooms.
With respect to Fort Erie and Port Clover, you mean?
Well, that's a long time thinking of any other than.
Where are you from?
Well, my paper is from Toronto,
Yeah.
but I have a place in Port Clover.
Get out of here.
Yeah.
I didn't know that.
Yeah.
Because I remember you said you were Toronto papers, and I was going to express the
Right.
question. I have said I would open up the Fort Erie ER. It's something that I've stood for a long time. And I think the question too.
What do you mean in Fort Erie?
Fort Erie. And I'm willing to talk to folks in Port Clover what their preferences are going forward. But the Niagara health system is in desperate need of a significant top to bottom review. I think, I'm trying to remember now, time flies now, but about 6 years ago, I called for an outside person to come in and to go through the NHS. I'm very concerned. It's a multi-site system. We seem to be building more and more administration. Some of the salaries, if you look at them on $1,000 a year list of folks who don't deliver health care, there's got to be a better way of delivering service. I'm proud of it in Westlake Memorial Hospital. It's got a great relationship with Hamilton Health Sciences. I think the NHS is badly dysfunctional. And the recent review they did was basically a rubber stamp. It was just rubber stamping the project that was already underway. We need somebody from the outside with no skin in the game, objective, to tell us if the NHS is delivering healthcare appropriately, and if not, make changes.
Yeah, one further question.
Well, you're saying the LHINS are a home for bureaucracy, but isn't that the whole idea of the government's started from Harris at the beginning? Everything is centralization, the school boards, everything, and so all we have is big bureaucracy, big buildings with a whole lot of people say school in this town, school in that village. What's your government? Can you change that?
We are going to bring change, and that's you'll see that as a very substantial part of our campaign. I just picked that up from folks everywhere, whether I'm in Cornwall or in Jordan or North Bay. I do think that a number of things we touched on. I reject the LHINS. Government will have to shrink. There's no doubt. You need to set priorities, right? This era of trying to be all things to all people and throwing money to every problem under the sun got us into a $17 billion deficit. Believe it or not, we're actually on track under the current premier to doubling Ontario's debt. So it took the first 35 premiers 142 years to do. Doing that with the head. Dalton McGuinty is going to double it his time in office. Will there be some difficult decisions? No doubt. Here are the priorities I would say. Frontline health care and classroom education. We need to find savings in bureaucracy, so you'll see less bureaucracy. I mentioned the agencies, boards, and commissions earlier on. That's a particular target of mine. There's 630 of these things. pass on the savings to higher users as well. But you will see from a PC government the honor of serving a focus on making government work for people who pay the bills, focus on the front line, like healthcare and classroom education. But we'll have to find savings in other areas, and I named some few, like the LHINS, like the OPAs, agencies, boards, and commissions. Sorry for the long answer there. Thank you. So I get a gift for all
You get a
this
gift.
work, eh?
Wonderful.
Fantastic.
Thank you very much for coming today.
My
Appreciate
pleasure.
your understanding of our issues and see these across the province. And also thank you for your openness and your staff's openness to our members. We appreciate that.
No,
And we hope to continue the dialogue.
absolutely. Appreciate the work, folks, that you do.